NPC deputies called for additional reform of China's healthcare system amid mounting costs problems at public hospitals and a surge of patients with chronic diseases. Hello and welcome to Voice and Votes 2013, providing you an in-depth report on China's annual political meeting. I'm Andrew Xin here in Beijing. Also in this program.
And one of the reforms brought in by the Labour government after the war was to have a universal health care system for all.
We talked to China Daily's columnist Brian Salter. He weighs in with his opinions on the UK healthcare system. Leaders of the world's most populous country are spending billions of dollars each year to improve healthcare and cover costs. 3 years on since the reform were introduced in 2009, over 1.5 trillion yuan has been invested in the medical sector. A Medicare network has been introduced covering more than 95% of China's population. About 63 billion yuan has been invested by China's central government to help construct 33,000 county-level hospitals and village clinics. Our multimedia reporter DJ Clark has the details.
As I make my way around rural China, I'm starting to enjoy the quietness of the countryside. Kengxi village, a 3-hour drive south of Hanzhou in Zhejiang province, is no exception. The odd sorghum plant rustles in the wind as I look out over expanses of open paddy fields with mist-covered mountains behind. As I enter the village, I was taken to the clinic and introduced to Dr. Zhang Lifeng, who sits at a table opposite his brother, also a doctor, seeing patients one by one in an open consultation room. Dr. Zhang came to the village to work in the clinic in 1987. Things changed very little until 5 years ago when the government implemented a new rural health policy, greatly subsidizing the doctor's treatment while implementing a strict policy on medicine sales.
国家是预算也拼领效果差的根本是一个么子我说了报销比这高些外国也拼不自然进的来一块马登在外的一块发生钞票的那么我说了去报销一块去年是2%的是也报销中年报销4%是吧一个么10倍是了这外一个呢是这个俺就感觉理财包括慢性病高血压糖尿病肿瘤精神病各种病主要上面就管理那一个人想想可这个菜刀挺好你个菜刀职业要到菜刀里去上面慢性病的人高血压各种人上面的采访无上的各种这样服务
Back in 2005, medical insurance was predominantly for city dwellers, covering only about a quarter of China's population, and 80% of all the medical facilities were based in urban areas. To offset this imbalance, China set out a 5-year plan to rebuild the rural medical service system by supporting the construction of county-level hospitals, grassroots medical care institutions, and village clinics. They also set up an affordable rural health care insurance, all in all spending 1.13 trillion yuan over the last 3 years, according to Vice Minister of Finance Wang Jun. By the end of last year, the new rural cooperative medical care system covered 830 million rural residents, raising China's total health insurance coverage to 95.5% of the population. Around Kengxi, all of the people I met were aware of the new system and most seemed grateful for the support. Back in the clinic, Dr. Zhang and his brother are busy as new patients arrive every few minutes to seek help for their ailments. With the government support, Dr. Zhang believes he is providing a much better service, which he demonstrates by referring to the growth in the clinic budget. This is DJ Clark in Kenshi Village, Zhejiang, for China Daily.
That's my colleague DJ Clark. Now let's talk to Brian Salter, also China Daily economist, for his opinions on the UK healthcare system. Stay with us. Brian, thank you so much for joining us today. First of all, can you introduce the current UK healthcare system for us?
Well, the NHS, the National Health Service, was introduced after the war as a result of when people were fighting together in the trenches and in World War I and fighting together in World War II, the class system started disappearing in Britain. You remember Britain used to be a very class-conscious society. And one of the reforms brought in by the Labour government after the war was to have a universal health care system for all. And basically the premise was that it didn't matter how rich or poor you were, whether you could afford it or not, the health care would be there for you, and you would get free health care. What that meant was if you had to go to the doctor, it was free. If you had to get medicines, it was free. If you had to get an operation, it was free. Now, over the years, that changed a bit because health is very expensive.
Even for diseases like cancer and leukemia.
Everything was free. Now, it's changed over the years. So, for instance, nowadays you pay a small fee for every medicine you have to get. It doesn't matter what the medicine is. You pay a standard, I think it's £6.80 for the medicine, unless you're 60 years over, and then it's free. If you have an operation, it's free. If you want to go and see a doctor, it's free, always. And, of course, if you want to beat the system, you don't want to queue up with everybody else, then you can pay and go to private, and you pay for that, of course. But in general terms, the premise of the NHS is that it's free for all. And that's a very good principle to have. In practice, it's never as good as the original people who designed it intended. But having said that, it's still very good.
Have you ever been to a Chinese hospital before?
Yes, I have, actually. I went to a hospital actually just around the corner from here, and it was quite an experience.
Wow, what quite an experience.
Well, it was an experience in the sense that I had a chipped tooth. I'd bitten into something hard and had to go and see a dentist. And they had a dentist in this hospital. And I remember that I had the dentist drilling holes in my tooth while some windows, literally about the same distance as I am from you, were being taken out and replastered and everything else. It was quite weird having workmen working all around me. But having said that, I was very impressed because they had the latest equipment. It was very, very good. I was seen straight away, no queuing like you often get in UK hospitals. Now, OK, it was an expatriate arm of the hospital. One has to say that, and I'm sure it wasn't the same at the Chinese end of the hospital. But having said that, I was very impressed with what I saw.
So in what area do you think that China could learn from the UK system?
Well, I think one of the things which actually was in the news just recently was the fact that they are now talking about people not having to pay in advance before they see a doctor, because it puts many people off from being able to see a doctor because they wonder if they can afford it at all, or if they have to have an operation. Maybe they think they can't afford it, and so they try and do without the operation, and that puts lives at risk. So now a lot of it's a debate within Chinese society about whether people should actually be seen by the doctor and then start wondering after that how to pay for it, rather than have money up front before you can see anybody at all. I think that's very good indeed. But having said that, the prices of medicines, of course, they're market prices, world prices. A lot of these medicines come from international companies, and they can be very expensive indeed. So, again, whether it needs to have a system whereby in the UK, as I say, you pay a standard amount for whatever the medicine is, that's quite good. Or a health insurance for all, where everybody has to pay health insurance like you get in the States or like you get in France or whatever, where it's the insurance which pays for your medical costs. Again, that has drawbacks in the same way the NHS system in the UK has drawbacks. there's no perfect system. But I think there's a mixture of lots of different systems is quite a good idea.
Okay, Brian, thanks you so much for being with us today. Well, we have received 2,195 responses from our China Daily mobile news platform. Let's take a quick look at the poll results. Actually, 16.5% of the participants support Zhou's idea. A 66.5%, actually the majority of participants are against it, and 17% neutral. Here is a response to yesterday's topic from Fuzhou, actually Fujian province. He said, I don't agree with Zhou's idea. Doing charity should be a voluntary behavior. If it becomes a forced act based on legislation, people will begin to resent it and thus do harm to the charity enterprise in the long run. As for lower income earners, the legislation would make charity a burden of living. Let's take a look at today's interaction topic. Singer/CPPCC member Jin Tiling suggested that provincial TV stations should rotate to host the annual Spring Festival Gala, which will bring more innovation to the program. What do you think? China Mobile users can text response to 1065 8000 7835. And smartphone users can also comment on our respective China Daily iPhone and Android applications. Until then, bye-bye.